research indicates that over 80% of dental hygienists complain of upper body or lower back pain. This is a staggering number, so being mindful of our posturing is going to not only help us reduce the risk of having one of these work-related injuries, but also is going to be able to prolong your career as a dental hygienist. So what we want to do is have you practice and be mindful of what we call the neutral position. Okay? So the neutral position is going to include both our patient and ourselves. We're going to be able to go through a checklist. It's going to include kind of from the top down, our neck, our shoulders, our waist, all the way down to our hips and our feet. The easiest way to start is that we're going to start putting our patient into what we call a neutral position. And I'm going to take Mr. Jones here, and I'm going to lower the chair. So the first thing you always want to do is get your patient seated first, and then start thinking about that checklist for yourself. So a neutral position for a patient is where the patient is, their head and their mouth is parallel with the floor. Their legs are out. If I have Mr. Jones' head up past that neutral, it's going to change my positioning. So the most important thing is to get that patient laid back and seated first. And how I check that is that I take my arm, I lay it across my waist, and I want my elbow to be level with his mouth. This is going to set me up to have the best chance of remaining in a neutral position. So now that I know that my patient, or Mr. Jones, is in that neutral position, I'm going to start working on myself. So with my neck, the goal on my neck is that I want to be in a position where I can do a slight bend, but I don't want to have to drop my neck entirely. My shoulders want to remain as flat as possible without having to raise them or lower them. My hips, I want to keep my hips at a 90-degree angle, and I want to have that weight evenly distributed onto the seat of my chair. And I want to have my knees and my legs at a 90-degree angle so that my feet can be flat on the floor. Your chair adjustments will allow you to either lower or raise that chair. And if you feel that you're slanted down, you're slightly too high. You want to come down where you feel that there's even distribution of weight here and that you can form that 90-degree angle by having your feet flat on the floor. Okay? So now, when I work on Mr. Jones, I should be able to roll over here, keep my feet flat on the floor, come slightly forward. So if I'm going to bend from my waist slightly forward. I'm not going to try to hunch my back to get over. I should be able to come forward, and I want my eyes to be in directly over the area in which I'm working. The one thing that will really help you keep your posturing at the top is purchasing loops. Loops are one of the most important pieces of equipment that will help you ergonomically. So what loops do is they magnify your treatment area. They give visual acuity to the treatment area that you're working at. So this way it allows me to get into my position, get my eyes over here, and be able to work on Mr. Jones without having to get this close. Because as soon as you start dropping to have a closer look, you've taken your entire alignment out of position. And over time, to have to do that once in a while is not so bad. But over time, if you're constantly working like that, or if Mr. Jones' head is up, and to see you've got your elbows like this, or any time that you're out of that comfortable, evenly weight distributed, feet flat on the floor, you're out of neutral position. So sometimes you get into the moment and you're working on your patient. As instructors, we will come around and remind you nicely of the details of ergonomics and to get you more properly aligned to help you understand